Thank you. It's a pleasure to be talking to you today. I'm going to go over the medications that we put you on whenever you have heart failure. Why are they important? Because they help you live longer, they help you breathe more easy, they help you have more energy, they help you have less swelling, and most importantly, they keep you out of the hospital. As a general information, as doctors, we start you always at a low dose of these different medications. And even if you start feeling better with these low doses, we start to push you to higher doses. Why is that? Because studies have shown that these medications work at a certain dose the best. This is why we try to push you to these doses if you are able to tolerate it. In general, some medications are going to make you feel better. Some medications will make you feel better and live longer, and some medications can harm you. So let's move to talk about them. There are different types of medications that we use in heart failure, the water pills or diuretics. And then we have the hormonal blockers, and these fancy names, we'll go over them, and you probably know them by their brand names. So I'm going to start by talking about the water pills. Different patients might be on different water pills. The most common water pill is Lasix. The generic name is furosemide. You also have Bumex, bumetanide, or Demodex, torsemide. Your provider will decide which medication for you to be on, depending, number one, on cost. Sometimes we start with Lasix, and then with time, patients can build resistance or tolerance to Lasix, and we move to Bumex or torsemide, which are better absorbed as pills, especially when you are congested and have a lot of swelling. So what do these water pills do? They help you get rid of the extra fluid by peeing. Therefore, you have less fluid in the lungs, and this is why you breathe better. Less fluid also means less swelling in the legs, therefore less edema. Overall, this is a class of medication that is going to make you feel better. What to watch for when you are taking water pill? Because you're going to pee this extra fluid, you might have low blood pressure. It also is going to deplete your potassium, because not only are you going to pee water out, you're going to pee potassium and you're going to pee sodium. This is why we ask you to come back for frequent blood check, especially when we make changes to the water pill dose, right? We ask you to come back in a few days so we can make sure your blood work looks okay. And we also want to check your kidney function, your creatinine. It's very important when you are on a water pill to weigh yourself daily, because we don't want you to come to clinic every day so we can make sure that these medications are working. You have to own a scale and weigh yourself daily. We set goals for how much water you need to lose, and we decide on the dose of the water pill depending on your weight. Another kind of water pill is aldactone or spironolactone. This is not only a water pill. It's an anti-hormonal medication. It works with Lasix because this is a medication that's going to keep your potassium stable. So Lasix and the rest of the loop diuretics are going to make you lose the potassium. This is going to make you hold on to potassium. So it's a nice balance when it's used with the Lasix. This is not only going to make you feel better, it is also going to make you live longer, okay? So this is a medication where you feel better and you live longer. With it, you have to watch for high potassium, so we also have to check your kidney function. And especially for men, you have to watch for breast tenderness or breast enlargement. If this happens when you are on this medication, there's an alternative medication called eplerenone we can put you on. So please tell your doctor. When loop diuretics, that is the Lasix and the other classes, and spironolactone together fail, there is a medication called metolazone. This is a booster medication. It's going to help them work better, especially when you are on higher doses of the rest of the water pills. Okay? So as a summary, you have the loop diuretics, you have aldactone, and you have some extra booster pills which we can add to make the other ones work better. Some general questions about the loop diuretics or the other diuretics that you might have. Can you take these water pills and leave the house? I mean, you're going to be looking for a bathroom all the time. Some strategy you can have is take them earlier on, okay? And then you can leave. Or look for where the bathroom is, identify it, and know. Or you can go on your trip and then come back and take it. What we don't want is for you to miss doses, okay? Do not miss doses of these water pills. If you are awake at night peeing, what can you do? We don't want you to take, for example, if you're on twice a day of water pill, don't take the second pill before you go to bed. Take it early on, okay? So take it after lunch, take it in the afternoon. Don't wait till the evening to take it, and then you're gonna stay awake the whole night. If you are doing like your doctor is telling you, taking every medication that he's recommending, you're taking the water pill, but you are still short of breath and gaining weight, you have to inform us, because it means you might need maybe different combination or different doses. Now, in heart failure, like Dr. Ginwala already said, we have hormones that are not good, that are increased in heart failure. Therefore, we need medications to block them. Right? I started by saying we have the angiotensin blockers, we have the beta blockers. So these are going to block these hormones that are increased in heart failure and are not good. So these are the two classes, the ACE inhibitors and the beta blockers. So the ACE inhibitors, some common examples are lisinopril, the brand name is Zestril, enalapril or Vasotec, ramipril or Altase, and sometimes in the hospital we might put you on a medication called Captopril. It's a 3 times a day medication, and we try to go up on it to get you to the rest of these medications. So how do they work? They help relax the blood vessels, lower the blood pressure. Therefore, it's easier for the heart that is weak to pump blood. And it also helps the muscle of the heart get stronger. Therefore, it makes you feel better, it helps you live longer, and it keeps you out of the hospital. Some things to watch for with the ACE inhibitor is angioedema, swelling of the lips, difficulty breathing and difficulty swallowing. It is especially more common in African American patients, so be mindful of that. And it can happen at any time during treatment, not just at the beginning. So if you are on any of those medications that I already said and you develop that, please, the first place where you're going to go is the emergency room, so let them know so they can recommend stopping this medication. If this occurs, or if you have a dry cough, which is another side effect, we can switch you to an alternate class which works similar to the ACE inhibitor, and it is the angiotensin receptor blocker. Some examples are either candesartan or valsartan, that is Atacand or Diovan. When you are on these medications and you are a young woman, you cannot get pregnant because they cause fetal deformities. So if you are planning to be pregnant, first you have to discuss with your provider, is it safe or not with your current heart condition? And number 2, the provider will have to switch you to alternate medication. So a young lady with heart failure on these medications need to be on 2 methods of contraception. Let's move on to the beta blocker. Some of the beta blockers are either Toprol XL, bisoprolol, or carvedilol. Most of you here are going to be on Toprol XL or carvedilol. These are very effective medications in patients with heart failure. They help improve your heart function. They make you feel better. They make you live longer, and you stay out of the hospital. So thumbs up for the beta blockers. The way they work is, again, they block these stressful hormones that are not good in heart failure and help the heart relax. Not only that, they also control high blood pressure, they prevent heart attacks, they regulate the heart rhythm. And you know what's nice? They also work even if you don't have high blood pressure and you have a regular heart rhythm. Some of the side effects, you can feel tired and dizzy, but that only happens at the beginning or when we are increasing doses. In a few days, that's going to go away. Okay, so don't stop the medication because the first few doses you're feeling tired and you have less energy. You might experience more fluid buildup in your body, especially if you have advanced heart failure, edema with them. And in some patients who have asthma or COPD that is, again, severe, you might have some wheezes with it, and it also depends on what kind of beta blocker you are on. Now, general question about the ACE inhibitor and beta blocker that you have to ask yourself and ask your provider. First, if you have a heart failure and you have a weak heart, you have to make sure that you are on an ACE inhibitor or beta blocker. If you're not, you need to know the reason. And you have to make sure you are on the right dose. Because like I said in the beginning, we have to get you up to the right dose, to the good doses. Let's move on to hydralazine and isosorbide dinitrate. These medications help in addition to the other medications. So they have an additional benefit. And that benefit is of particular importance in patients who are African American. The way they work is they help your blood vessels to relax, they drop your blood pressure, and drop the work of the heart. Some side effects are headaches or low blood pressure. If you are a man and you are on erectile dysfunction medication, you have to let us know, because that combination with hydralazine and Izordil can drop your blood pressure. Digoxin. Digoxin is a medication that's been there for a long time. It's extracted from the foxglove plant. It keeps you away from the hospital and makes you feel better if you're short of breath and fatigued. Some things to watch for, that means the level might be too high, you're nauseous, you're vomiting, you have a blurred or colored vision, you have an abnormal heart rhythm, you have palpitations or fainting. Now, I'm gonna move on to these medications that some patients who have heart failure are on. They're not directly just for heart failure. So aspirin, as you all know, it helps kind of prevent further blockages of blocked arteries. If you've had heart attacks, if you've had bypasses, if you've had stents, you're going to be on an aspirin. Blood thinners, the Coumadin, it thins your blood and prevents clots, especially if you have certain abnormal heart rhythms that can make you develop blood clots in the small heart chamber of the heart, the atrium, or if you have a weak heart and that area of the heart is not contracting very well, clots like to go and sit there. Therefore, Coumadin is going to help prevent these clots. Now, some of you might be on newer blood thinners, different name, Pradaxa, Xarelto, Eliquis. These have the advantage that they don't need monitoring and testing like Coumadin does, and they don't have any limitations in the diet. Now, you might ask yourself, I'm still on Coumadin, why am I not on these newer agents? They're not for everybody. It's going to depend on your kidney function, your liver function. And some providers might still like Coumadin because it's been here for a long time, and we know how to reverse it in case you're bleeding. The rest of the medication, on the exception of one, we don't have a reversal agent. So if you're bleeding, we don't have reversal agents. Now you're going to ask me, all of these medications on themselves, you're saying they have very good effects, so why can't I just take one? No, you cannot. You have to take them all because they are stronger together. No political message, but just a medical one. Okay, the medications are stronger together. I'm going to also talk about some medications that you should not be on. You cannot take ibuprofen, Advil, Naproxen, Aleve, all of these non-steroidal medications. They are not good. They make you retain fluid. They make your blood pressure go high. So all of these good medications that we have you on, that's going to work against them. And also they can affect your kidney function. The other class is diltiazem, verapamil. These are the calcium channel blockers. Some of you might be on them for rhythm or blood pressure control. A weak heart does not like them because it's going to make the heart a little bit weaker. Also, ephedrine or pseudoephedrine, these over-the-counter decongestion, they're going to make your heart beat faster, and we have you on medications to help relax the heart and make it beat slower, so you cannot take those. Some helpful hints. Please have a pill box. This is going to help you remember that I take my medication or not. And then you're going to sort them out beginning of the week and make sure you're taking them all. Have a spreadsheet where you have the names of your medication, and you have to have a column where you know why you're taking them and who is prescribing them and at what dose. And most importantly, please bring your bottles with you when you come to clinic. Don't bring the discharge summary, don't bring the paper. We need to see the actual medication bottles. And medications alone are not going to work. Like Dr. Bernati said, it has to be a lifestyle change. You have to eat healthy, you have to exercise, you have to cut the salt.